Hey, my name is Danilo Perez, and I'm currently an undergrad at the University of Puerto Rico at Cayey. For about 2 years now, I've been working with Dr. Maite Cruz and a group of other talented undergraduate students on a project in computational endocrinology. Specifically, we were interested in developing a computational system where, by using differential equations and their analytic simulation, we could precisely simulate the fluctuations of glucose and insulin experienced throughout the day for an individual. Now, if this individual were following a particular diet or characterized by distinct biophysical parameters, the system could accommodate for this. Well, glucose-insulin dynamics are fundamental dictators of diabetes mellitus, a condition that, in 2012 alone, affected more than 25 million Americans. Normally functioning insulin mediates signals that result in the correct reduction of blood glucose levels a person will have after consuming a sugar-enriched food like a donut or a cake, or just a regular old breakfast. Diabetes is then characterized by either an inefficiency surging in the effect this insulin may have on correctly regulating blood glucose levels, or by the overall loss of insulin production due to overworking the beta cells, who are the cells responsible for this insulin production. The net result of either of these happening is that these patients suffer of hyperglycemia, a condition in which blood sugar levels just skyrocket, and the body begins to suffer a large amount of stress, attempting to regulate these levels through secondary mechanisms or options that are just not as optimum as the correct usage of insulin. Quantifying how these dynamics work allows physicians and scientists in general to identify then what are the aggravating factors that are leading to the development of their patient's condition, offering a profile of how their condition has progressed from health to prediabetes to type 2 diabetes, and how it probably will continue if the patient maintains his unhealthy habits, potentially developing into a type 1 diabetes. We have successfully identified factors such as insulin depletion and fat deposition as factors that may aggravate the condition. But now, we hypothesize that modifications in the patient's diet can be characterized for the impact it may have. Our work would then be clearly beneficial for both the physician and the patient, as they would both appreciate seeing how minute details such as exercise or diet modification can help slow the progress or even reverse the trend of their condition. Diabetes is a condition that definitely does take a person by surprise and is accompanied by a steep learning curve. You're essentially told that what you've been doing for your entire lifetime has been incorrect, and you must now begin to change your entire lifestyle. I would love to offer insight to these patients as to how my research and that of my peers is working to help them, and how it will help them in their day by day and not just in some long term that they really can't attain. So, being able to explain myself and truly communicating my research effectively essentially goes hand in hand with really executing my research. I don't think the project would be complete if I were not able to communicate it.